Hi, everyone. Welcome back. My name is Dr. Samantha, and I'm the maternity mentor. And today we are here for another one of our live Q&A sessions where we answer some of the questions you guys have submitted on our videos. We also take questions from you when you log in and join us in the chat. So please feel free at any time to put anything you'd like in there. We are also on Facebook, Instagram, and Twitter. So please head on over there and you can check out some of our additional content. And please remember to subscribe to the channel and make sure you hit the notifications button so you can get notified whenever we put out a new video. Again, I'm Dr. Samantha, and let's get right into it with some of your questions this week. So our first question is, I am 38 weeks and have the pain in the navel area and a harder stomach. Now, this question was asked on 10 signs of labor video. So when you have pain in the stomach and the stomach is harder, this could be a contraction. So contractions are basically when your uterus, it squeezes or hardens up in order to help pull the cervix open so that your baby can descend and you can have a vaginal birth. So it does feel like it's hard as a rock. And the difference between something that you really need to be concerned about and true labor is that contractions, your stomach will harden for about 30 seconds to a minute, and then it softens again. And the contractions will be 10 to 15 minutes apart at first, and then they'll get closer and closer and closer together until they're lasting, for at least a minute every 2 to 3 minutes. Now, one of the things I'm going to tell you is you don't want to just assume that because you have a hard stomach that you are in labor, even if you're 38 weeks pregnant. Just because you're pregnant doesn't mean other medical conditions couldn't occur. One of the most common things that can cause a stomach to be hard is infection. And one of the things that can cause pain at your belly button is appendicitis. Appendicitis can happen to anybody at any time. So if your stomach is very hard and you're having a lot of pain and that hard feeling doesn't go away, you definitely want to get a hold of your provider as soon as possible and let them know what's going on. Most providers are going to tell you what contractions will look like, and they will give you guidance at the end of your pregnancy about whether to contact them or not. So if you're not sure, feel free to contact them because that's what they are there for. So that was a really good question about, whether this is a sign of labor. All right, our next question came to us on the preeclampsia video. So just as a reminder, preeclampsia is a condition that can happen anytime during your pregnancy where you experience high blood pressure and organ failure, usually the liver, but sometimes the kidneys. And the combination puts you at risk for seizures. So on the preeclampsia video, the person writes, I'm 20 weeks pregnant and I had a blood clot issue and my protein is less. My doctor suggests that I take an enoxaparin injection. Is there any problem? I have a prior history of placenta abruption. Okay, so placenta abruption, for anybody who doesn't know, is where the placenta, which is the organ that feeds your baby, it's on the side of the uterus and it comes off of the uterus like this, okay? That's a life-threatening emergency for both mom and baby. It usually results in an immediate C-section because otherwise both mom and baby could bleed to death. Now, in this case, she's being offered enoxaparin. So the brand name for that medication is Lovenox. Lovenox is a medication that we give to women to help prevent blood clots. So blood clots are little balls of blood that can occur at any point in time. Now, when you're pregnant, you are at a higher risk for blood clots. You have certain chemicals and proteins and stuff in your blood that are supposed to be there for pregnancy, but they make it a higher potential for you to develop a blood clot. Now, some of these blood clots can travel around your body, and they can be dangerous if they were to, say, lodge in the small vessel of your heart or your brain. That's what usually causes a stroke or a heart attack. One of the other things that a blood clot can do is the blood clot can go behind the placenta. So it can lodge behind the placenta, and this can actually cause a mini abruption, where again, a piece of the placenta is pulling away from the wall. However, this can be a little teeny, teeny, tiny area, and it is not considered life-threatening. However, if you are experiencing a lot of blood clots, your doctor wants to make sure this doesn't become a concern. So we often give you a blood thinner like Lovenox. So Lovenox is a little teeny tiny needle and an injection. You can give it to yourself at home. Some of the biggest risks include bleeding a lot. So you can get nosebleeds, your gums can bleed when you brush your teeth. You also can bruise a lot. So women are educated to be very careful about falls and different things. Now, the question becomes, is Lovenox safe during pregnancy? And the answer is absolutely. Now, you want to be sure that you are being seen by a maternal fetal medicine physician, which is the physicians that take care of high-risk pregnancies. Any mom who's being recommended to use a blood thinner is a high-risk pregnancy, and you want to make sure you have a specialist on board. So these doctors can help guide your care. If you're early in your pregnancy, depending on the diagnosis that you were given that causes you to need a blood thinner, they may actually switch you over to something called Coumadin, which is a pill that you can take for thinning your blood. And then right before delivery, they may switch you to Lovenox or vice versa. A lot of times when patients are on Lovenox, they are also brought into the hospital a couple days ahead of delivery to switch over to heparin, which is a shorter acting blood thinner. So, this all sounds safe. And I would say that, what they're worried about is you developing a clot underneath the placenta, which could lead to a placental abruption. So that was a good question. All right. Our next question, is smart water good for making formula? I would love for someone to tell me what brand I should use. Okay. So Smart Water is a brand name water that is sold here, but there are very similar waters that have also been found. So Smart Water is a water that contains electrolytes. And that's very good for us adults because when we're running around and we're exercising and we're doing different things, we can get dehydrated. And when you get dehydrated, not only are you losing water, but you're losing electrolytes. Electrolytes can include sodium, magnesium, and potassium. So drinking smart water for us is great because we need all of that replaced when we've been exercising. But using smart water for a baby is not recommended. So you got to understand, if you're using smart water to make formula, you are making formula. And the formula is basically a powdered mix. And if you look at the back of the formula container, you're going to see all of the different ingredients that are included in that formula to make it the perfect food for your baby if you're not breastfeeding. So that formula has electrolytes in it. And babies, they're very small, and their kidneys and liver, they can be overloaded very quickly. So you want to make sure that you're using the right amounts of things. When you use something like smart water would actually potentially overload them with some of those electrolytes. Why is this serious? Well, if you have too much potassium, that can lead to heart arrhythmias because potassium it's like an excitatory electrolyte, and what it causes is the little like neurons and the little electrical nerve impulses to fire rapidly. These are the things that cause our muscles to move. And so if a baby or an adult have too much potassium, that can lead to heart issues. So your newborn, your infant, even your toddler should not be drinking smart water unless your pediatrician has directed you to do so. The formula itself has everything you need. You want to stick instead to purified water, maybe distilled water, okay? Maybe even the reverse osmosis filtered water. But if you have a clean drinking source right out of the tap, you can also use that. Okay, but no smart water for babies in their formula. Welcome anybody who's coming in for the Q&A. Please feel free to type any of your questions into the chat. All right, so vaginal discharge. I have a light green watery discharge, but it is not smelly, and I have taken antibiotics. Okay, so I think that she's asking, like, what do I do? You know, what's the deal? So any vaginal discharge should be taken seriously during pregnancy. So there are some normal vaginal discharge that you can expect. And some of that's protective to help like coat the cervix and coat the vaginal canal to prevent bacteria from going up into the uterus, which could cause infection. However, there's a lot of vaginal discharge that's not normal, and you want to get it checked out. Most of the time, that's either going to be caused by yeast or a bacterial infection. Yeast and bacterial infections, if left untreated, can cause preterm labor, miscarriage, and even stillbirth. Additionally, if that bacteria was to invade the uterus, it could potentially get into the mom's bloodstream, and that could put you at risk for sepsis, which is a blood infection that can affect some of your organs. So you want to make sure you get it checked out. The way to get it checked out, you call your doctor and you say, hey, I've got discharge and this is what it looks like. They're going to bring you in and they're going to go ahead and they're going to take a sterile cotton swab and they're going to swab that discharge and send it to a lab. And the lab will test it to see what the discharge is. Now, very specifically, this description is light green, watery discharge. One of the most common causes of something like this is trichomoniasis, which is a bacterial infection that can occur in the vagina. And it is a sexually transmitted disease, and you want to get it taken care of right away. Trichomoniasis left untreated can lead to preterm birth. So it's very important to talk to your healthcare provider because it can be treated with antibiotics. Now, this mom mentions she did take antibiotics. So what's the deal with that? Well, one of the things you need to know is if you've been given antibiotics, a lot of times 1 or 2 days into the treatment, you start to feel better. And then it's very tempting for a mom to stop the antibiotic because she feels like less medication is better for the baby. But in the case of antibiotics, it's actually very important that you take the total amount that was given to you. Because, see, bacteria are funny. You know, when you take the antibiotic, at first you kill off a lot of them, and that's why you feel better. But there's usually some left over in your body, and it's hiding. And it's learning what antibiotics being used so it can build a defense. So unless you keep at it, you're not going to kill all those hiding bacteria. And then in a couple of days, the bacteria is going to start to grow and multiply, and then you feel sick again. Only this time, the bacteria won't respond to that antibiotic. What often happens then is a healthcare provider is forced to prescribe a stronger medication. And some of these stronger medications put your baby at increased risk. So if you are given an antibiotic, please make sure you take the total amount that was given to you. Without knowing for sure, it's possible that in this case, the mom did not complete her antibiotic course, and therefore that's why she's still having symptoms. So that's a great question. All right, so the next one. Hello, I lost my daughter a week and 10 days ago. I went into premature labor. I was diagnosed with an incompetent cervix. I had pain and tightening one morning and a little leakage. I found out that the sac had come down and I was transferred to another hospital in hopes of doing a cerclage. The sac had prolapsed too much into the cervix and the cervix was soft, so I could not get the cerclage done. I went into labor 3 days after the sac had come down. I also had a UTI. I just wanted to know, if it had truly been an incompetent cervix. I would highly appreciate it if you respond. So this is a very unfortunate situation, and I did send out a message of love and light to this viewer. I wanted to share her story because I think this highlights why we need to treat infections. So, of course, I can't say for sure what caused it, but the first thing I'd like to mention is that she says she had a UTI. UTI stands for urinary tract infection. So that's an infection of the urinary system. It usually happens when the bladder gets full of bacteria that travel up the urethra, which is the little tube that goes to the outside when you pee. So urinary tract infections are very common during pregnancy. And this is because baby sits on top of the bladder and the bladder can't empty all the time. And therefore, some of that urine with the bacteria in it sits in the bladder and it causes that bacteria, or gives the bacteria the ability to grow. A UTI, if left untreated, can lead to miscarriage. So how exactly did that happen in this case? Because what she's describing is that her cervix started to dilate. So you have a uterus, okay? And at the bottom of the uterus is the cervix, okay? This is the opening down to the vagina. So the cervix should be long, it should be thick, and it should be closed, meaning there's just this little tiny area. And what happens was when you give birth, when you go into labor and you dilate, that cervix opens to allow the baby to pass through. Your body senses when you are not doing well, when you have an infection. And urinary tract infections can lead to a systemic infection called sepsis, which is life-threatening for mom. If the body senses the infection is getting to be too bad, the body will do what it can to save your life. If it perceives that the baby is the issue, the body will cause preterm labor. Now, some women will experience silent labor or silent contractions. This means that the uterus is contracting in an effort to pull that cervix open so that the baby can be delivered. Now, when you're talking about early in your pregnancy, the cervix does not need to open to 10 centimeters. So what we normally hear is she's dilated to 10 centimeters. Now she can push. And that's like a big wide opening that's big enough for a full-term baby. However, when you're early in the first trimester, the cervix sometimes doesn't even need to open 2 or 3 centimeters and the baby can be delivered. The sac that she's referring to is the amniotic sac. This is where it holds the baby inside your belly while you are pregnant. So that sac is like a little balloon. And if it doesn't pop, then that balloon is actually a little bit firmer and can start to travel down the cervix. Now, what's a cerclage? A cerclage is where we do a stitch. Just like when you're sewing, there's a needle and there's sterile surgical thread. And they basically sew this closed. They're trying to keep this closed. But in her case, she was already dilated and that sac had come down. So there was no place for them to go ahead and to sew it shut. She was probably admitted to the hospital and she was probably placed in a bed to try to keep her flat in hopes of like preventing delivery. One of the things that is just very important again is that this could have been an incompetent cervix, but it also could have been silent labor caused by an untreated urinary tract infection. The other thing that I want to highlight from this is that it's important that after you have a loss like this, that you go ahead and you seek out help. There's a lot of different support groups like Rachel's Gift and Postpartum Support International that have resources for family members who have lost babies. So I definitely encourage you to check those out and try to get some, counseling and support during this very difficult time. All right. Our next questions are about antibiotics, and we get a lot of questions about antibiotics on the channel, okay? So our next question is Icon capsule safe during pregnancy? So Icon is actually itraconazole. So I apologize if I said that wrong. That's an antifungal medication. So these are treating funguses and stuff like yeast, okay? These medications can be very, very strong. So usually if you have a yeast or fungal infection, your healthcare provider is going to start at the low end. They're going to start with the most mild antifungals because antifungals can be very, very rough medications. Now, in this case, this is a much stronger version. It's not commonly used here in the US. However, there is some safety data out there that says this medication has a potential to cause some birth defects. So it is not recommended for use during pregnancy unless the benefits outweigh the risks. So what does that mean? If the mom has a fungal infection that is resistant to treatment, there have been other medications that have been tried and used, and nothing is working. Well, then mom needs to be treated with something because she's at high risk for preterm labor or miscarriage. So, if this is the medication that's available, it may be worth it for her to take. The other thing is, you can have birth defects throughout pregnancy, just depending on what system is being developed. But most birth defects will occur in the first trimester. So if you have a mom that's well into her second or even third trimester, using a medication like this may be worth it. Okay. But in general, this would be a no unless there was no other options available. So that was a good question. Remember, you can feel free to go ahead and put, any questions that you have into the chat. So, I have another antibiotic question. I'm 11 weeks pregnant and I have been given Gebexmine, I think, 250/500 milligrams. Is it safe? So, this medication is spelled, just in case I pronounced it wrong, so you guys know, Gebexime. So, this medication is not used where I practice. So, what do? You've been given a medication, you trust your healthcare provider, but you'd like a second opinion. Don't go to Google, okay? The internet is there and it's wonderful, but it's not always good for you to search on your own because you can find a lot of misinformation. I have seen articles on blogs. Blogs are not a reliable source that will tell you that prenatal vitamins can kill you. And prenatal vitamins are absolutely essential during your pregnancy. So the internet is not an option to get a second opinion. One great option when you're trying to check out medication to see if it's safe is to check with your pharmacist. Your local pharmacist receives extensive training on medications and their safety, and they are a very good option when you want to find out if a medication is safe to take during your pregnancy. So, unfortunately, in this case, I am not able to say for sure whether this medication is safe for you, but that's what I'd recommend that you do. All right. So, cesarean section question. I just got my C-section 24 hours ago and I feel deadly pain in my lower abdomen. And that really stinks. And I'm really sorry for this mom. And this really does bring up some good questions about cesarean sections. So, a C-section is a surgical birth. And what happens is you get a cut on the outside and then they cut the uterus where the baby is and baby comes out. The uterus is sewn up just like you'd sew a piece of clothing. It's got a dissolvable stitch that goes in there, and they use a needle and these surgical threads. The outside of your C-section, the skin part, can be closed a variety of ways. Some get dissolvable stitches. Some get stitches that need to be removed. Some get staples, which are exactly what you imagine, just like stapling a piece of paper. Those get removed a couple days later. And some get closed with a surgical glue and some tape. Okay, so there's a lot of different ways. And then usually there's a bandage, a very strong pressure bandage that's put over that incision for the first 24 hours, and then it's removed so we can look at it. So C-sections have pain. Okay, that is common, but we don't want you to be in a lot of pain. So let's first talk about the type of pain you can have. So I actually tell moms there's a couple different types of pain you can feel. So the first is a burning pain, and that burning pain is on the incision itself. That is normal. Those are the little tiny nerves on the skin that are reacting to that incision or that cut. So burning pain at the incision is normal. There's not much we can do about it, but it's not really that bad, and most people can get used to it. The next type of pain is like a deep cramping, like a really bad period cramp, okay? And it comes and goes. It can be worse when you breastfeed, because when you breastfeed, you release oxytocin, which stimulates uterine contractions. And that's exactly what it is. It's uterine contractions that are causing the uterus to go like this because the uterus needs to shrink back down. So that cramping feeling is normal. Now, the third kind of pain usually happens on the sides of your belly, okay? But it can happen all over. This feels like a bruise, or like a really bad bruise, or like achy, like somebody was punching your stomach, okay? To be very honest. So when you have this baby, they try to make the incision as small as possible. So as a result, they kind of have to pull and tug on you a little bit during the delivery. All of that manipulation, it feels really uncomfortable for the next couple of days. Seriously, when I describe it as feeling like you've been punched in the stomach, most women are like, oh yeah, that's exactly what it feels like. Or like I've done too many sit-ups. So that is the third kind of pain. The fourth kind of pain with a C-section is a sharp stabbing pain. This is excruciating. It is a 9 or a 10. It happens all of the sudden out of the blue. It's not necessarily caused by movement. It's not necessarily caused by anything. Okay. It can travel around, and some women will feel it in their shoulders or their chest. In fact, many women call us nurses into the room to say, oh my God, I think I'm having a heart attack, because they feel this sharp stabbing pain in their chest, and it can be right near the heart. This sharp stabbing pain is actually gas. So when we open you up and we make that little teeny tiny incision, we need to be able to see the uterus. So we make a cut that's safe for baby. In order to do that, we blow the belly up with air so we can see everything inside. Well, when we're done with the surgery, we try to get out as much of that air as possible, but you can never get all of it out. As a result, when you're sewn up, there's a little bit of air left in your belly. It's fine. There's nothing wrong with that. But that air needs to come out. In order for it to come out, it only comes out two ways. It comes out if you burp, and it comes out if you pass gas. So all of us labor and delivery and mother baby nurses, we tell moms, if you need to pass gas, pass gas. Do not hesitate. Don't worry if your husband's in the room, your partner, your mom, your best friend. Don't worry if we're in the room. If you need to pass gas, you let it rip. Because if you keep it inside, you get these sharp stabbing pains. And they move. If you think about it, if you've ever had gas and you're not pregnant, that's what happens. You feel it move through your belly. Now, why am I saying this? Why is it so important? Because gas pain, that 10 on the 0 to 10 scale, 10 being the worst you've ever felt, it doesn't respond to pain medicine. So all the pain medicine we give you, even the strongest medicine, does not touch gas pain. The only thing that makes it better is burping and passing gas and trying to walk around as much as possible to get it out fast. Now, let's talk about the pain medicine. So we usually offer you a couple different types of pain medicine. And one of the things that we offer from the beginning are some IV narcotics like morphine. And then we may switch to a pill like Percocet, which has codeine in it. So a lot of women are very hesitant to take these medications because they plan to breastfeed or have started breastfeeding. So what I say to moms is, it's good that you're asking. And of course, you want to make sure that you're taking only what you need. But if your baby needed surgery right after birth, after that surgery, they would give your baby little tiny bits of pain medication because they would be in pain, right? The tiniest amount of these medications goes through the little bit of colostrum that you have. Your baby's getting hardly any of it, okay? But what I will tell you is untreated pain leads to a stress response in the body. And that stress response can actually inhibit your milk from coming in. It can stop the milk from being produced. So the less stress and the less pain you have, the easier it's going to be for your milk to come in. Okay? So you want to make sure that you are taking the pain medicine. Now, next up, when do I take the pain medicine, right? So a lot of women, we use this 0 to 10 scale. 0 is no pain, 10 is the worst you've ever felt. So a lot of women, again, they don't want to use medicine. So they're toughing it out. They can do it. So they wait until they're a 9 or a 10. They're practically, if not crying. They're practically crying or if not crying, right? So you're at a 10. You call me in. You're like, I need the Percocet. That Percocet is going to take 30 minutes to work, and it's only going to take you from a 10 or a 9 down to maybe like a 5 or a 6. That's still a lot of pain. And a 5 or a 6 means you're still under a lot of stress. And what did I just say? Stress may inhibit your milk from coming in. So when should you ask for pain medicine? We usually say when you're like a 5 or a 6, you want to ask for pain medicine. Because if you're at a 5 or a 6, I can bring you down to a 2 or a 3. And a 2 or a 3 is reasonable after major surgery. It is expected that you may have pain after a C-section. We want to try to minimize that pain, but don't wait and tough it out because that's really not the best way to handle it, in my opinion. The pain medicine is there for a reason. Please use it. I see we have somebody who typed in the chat. Thanks so much. I'm so glad that you found us. Please make sure that you subscribe to the channel and hit the notification button. For those of you who are joining us, I'm Dr. Samantha, the maternity mentor. Welcome back. I'm here for another one of our Monday live Q&A sessions where we answer some of the questions that have been submitted on our videos. But if you guys have any questions that you want answered, please feel free to put them in the chat, okay? And we'll try to get to those. In the meantime, let's go ahead and we're going to answer our next question. So this one was kind of a comment. It was a really good one. It was on the diabetes menu. The diabetes video. And she looked at the foods to avoid, and she said, basically, we can't eat anything. So for those of you who haven't seen that, we're going to link that into the description. But we're also going to link our video that we did on keto, the keto diet during pregnancy. So you can actually eat a lot even if you have diabetes. The trick to that is you need to eat low carb, okay? So of course, we have to list some of the top foods, but keto is a very ideal diet for diabetes because keto is low carb, high protein, and high healthy fats. So this limits the amount of sugar that your body is, taking in, which helps with the diabetes. Now, one of the things that generally speaking is said with diabetes is you can't eat fruit. And, that's pretty good. But one of the fruits you can eat and is a staple in keto is berries, because berries have a lot lower sugar content and they have high fiber. So they make them ideal for diabetes. Now, you can also eat lots of protein and lots of dairy, okay? Protein and dairy are extremely good for you. But now dairy, it depends on what you're eating. Yogurt, high in sugar, okay? You don't want to be eating stuff like yogurt. Instead, you want to stick to stuff like cheese, and you want to do whole milk and other things. There's a world of foods that you can eat while you are pregnant. The other thing is moderation, okay? So let's say you're doing really good, you follow the diet, you're watching your carbs, everything is good, but you are dying to have chocolate ice cream every day. That's all you want. Okay, so first, you try to look for a whole milk chocolate ice cream, right? You don't want fat-free. Fat-free milk is actually basically totally sugar. It's full of lactose. They take out all the good stuff, which is that healthy fat, and all you're left with is sugar water. So you get a whole milk chocolate ice cream, right? Now, then you find one that's keto friendly, which exists. Because remember, ice cream usually adds sugar. So you want to find an ice cream that adds less or no sugar, hopefully one that uses natural flavorings like monk fruit, okay? Now, you have that. But that's still ice cream. I mean, let's just be real. It's still ice cream. So now moderation. So make sure you know the serving size and don't eat it every night, but maybe you eat it on Friday night and Saturday night because you're looking for a treat, okay? The trick with diabetes, especially when you're struggling with the diet, is moderation. That's what's key. One of the things with keto is that it's very low carb. So people try to stick to less than 20 grams of carbs per day, 25 sometimes. Well, if you know you're going out to a fancy restaurant with your best friend to celebrate her birthday, like an Italian restaurant, Italian food is all carbs, right? Well, maybe you spend that day during the day eating nothing but protein so you can help balance out the total amount of carbs that you're going to eat for the day. And then also, one of the quickest, easiest ways for you to avoid carbs is no sugary drinks. We drink a lot of sugar in this country, and by removing that, you remove a lot of carbs right from the beginning. But what I would tell you is there are a lot of foods that can be used when you're pregnant and have diabetes. Okay. Finally, if you've been diagnosed with diabetes, you're most likely seeing a maternal fetal medicine physician because you're considered high risk. They can refer you to a nutritionist that specializes in women who are pregnant and have diabetes. So please ask for this referral so you can also speak with a nutritionist about finding foods that are right for you. All right, so now our next question. So this is another C-section question. So I had a previous C-section in 2021, and I'm scheduled in June for my second. If my first one went smooth with no issues being sick with medications and anesthesia, does that mean that likely this will go as smooth? So that is a good chance that you will also have a very smooth delivery, but it's not a guarantee. So every time you have a surgery, things can be a little different. For one, if you feel a little nauseous, which can happen all of a sudden for anybody, they may give you extra nausea medication in the operating room. Okay, when you're getting a surgery, they don't want you to throw up. So as a result, they want to give you medication to prevent that. Well, that same medication can actually make you sick a little while later. So sometimes it can make you dizzy, sometimes it makes you sleepy and out of it. So it's possible that you will end up feeling sick due to that. Now, the other thing is, it depends on how the delivery goes. If it's a smooth C-section, relatively quick, no complications, then you may not need a lot of anesthesia and therefore you may not have any complications. But if something comes up and you need to be in the operating room a little bit longer so you get more anesthesia, that may cause you to feel sick also. And finally, it also depends on how soon you eat and drink after your surgery. Anesthesia can creep up on you at any time. I can tell you that I'm a nurse who likes to give my moms a little bit of ice chips sooner rather than later. But some moms that they have one ice chip and they just start vomiting everywhere, and we don't even really understand why. So just remember to go very slow when you start getting to eat and drink for the first time, because that is a very common reason why people start to feel sick. All right. For any of you joining us, please remember you can put your questions into the chat. We're down to our last question from one of our videos. So this is a bleeding question, and we get a lot of bleeding questions every week. I'm almost 16 weeks pregnant, and I've been spotting almost every day. My lower abdomen has a jabbing pain every now and again. Went to my OB, and they haven't given me a definite answer of what might be the reason for this. I was asked to take some laboratory tests to further check what could be the possible reason. So bleeding during pregnancy can happen for a variety of reasons. One reason can be that you have been having sex. So the hormones that help sustain a pregnancy, that are healthy for your pregnancy, they dry and thin out the vaginal tissue, which can lead to micro tears when you're having sex, which can lead to bleeding. So it's very possible that the bleeding is coming from this. It's also possible that there is a little tiny tear in the placenta that's abrupting. Again, remember, abruption is where it kind of separates from the wall. And that little tiny tear could be causing a little bits of blood to leak out. Another cause could be a low-lying placenta or a placenta previa. So this is your cervix, and a placenta previa is where the placenta sits right over top. And of course, if there's any tiny bit of dilation, you can have some bleeding come through. You could also have something called a subchorionic hemorrhage, and we'll link our video on that in the description. A subchorionic hemorrhage is where there's a piece of the placenta underneath that develops almost like a pool of blood, and some of this blood can leak out. So those are many of the reasons why you could bleed. One of the things you need to know about bleeding is that you want to report all types of bleeding to your healthcare provider, no matter what you see. Bleeding can be bright red, it can be dark red, it can be different shades of pink. It can also be brown. Brown is indicative of old blood. Any of these should be reported to your healthcare provider, and you should also report if the bleeding changes. Now, one of the things she mentions is that they asked her to do laboratory tests. So, what are those laboratory tests for? They're testing for infection. They're looking to see if there's something going on, because sometimes if there's an infection inside the uterus, this can make the inside of the uterus almost raw. And since there's so much blood flowing to the uterus to help sustain the pregnancy, that can actually cause some of that to bleed, like the uterine lining to bleed, because it's raw and the blood is right there. Additionally, this mom probably had some ultrasounds done. Ultrasounds help to look at the placenta and the baby and see if they can identify any reasons or causes why bleeding might occur. If you aren't able to reach your healthcare provider and you are bleeding, you want to make sure that you head to a local emergency room or hospital so you can get checked out. For any of you that are joining us, please feel free to put any questions into the chat that you may have, because we are finishing up our live Q&A if we don't see anything coming in. And for any of you who just came in, this is going to be posted on the website. We had some good questions tonight about sexually transmitted diseases and different things. I want to make sure that you guys remember we will be doing our live Q&As on Mondays at 9 p.m. Eastern Standard Time. We also are putting out new content on the channel, so please feel free. Please make sure that you like and subscribe and hit the notification button so you can get notifications when a new video comes out. I want to make sure that, again, if you have any questions, you put them in the chat now. And again, I'm Dr. Samantha. I'm the maternity mentor. And I really appreciate all of you. And I'm glad that you were able to join us tonight on this live Q&A. All right, guys. So I'm going to go ahead and end it here. If I don't see, I want to just give it one last chance in case there's anything coming through. All right. I want to make sure you remember to come back to us. And remember, have a great evening. Bye now from the Maternity Mentor.